everyone, I am Dr. Vaishali Sharma, consultant gynecologist, laparoscopic surgeon and infertility specialist. आज हम बात करेंगे candidates for IVF. Who all should go for IVF and who can wait? There are many causes of infertility. बहुत सारे reasons हैं जिनसे कि pregnancy होने में problem आती है. कई causes हैं which can be treated with medicines. There are some causes which we have to give for injections, and there are certain reasons for which we have to directly refer you for IVF. क्या causes हैं जिसमें हमें IVF करना चाहिए? Most important nowadays which we are facing is endometriosis. In cases where हमें endometriosis का diagnosis बन चुका है and there is a grading has been done that it is a severe endometriosis. In such conditions, we usually don't ask patient to wait too long. Because अगर severe endometriosis है and it has been proven in the laparoscopy that the grading is either moderate or severe endometriosis, then the chances of a normal conception are extremely very rare. So I would say just try for 6 months or maybe 1 year. But if you have not conceived even after trying for 1 year, then in that case don't waste too much of time. Get a treatment. We may give you some medicines and sometimes we even try for IUI. But in the cases of severe endometriosis, we advise you to go for IVF cycle directly because success rate of pregnancy in IVF in such cases is more. आप IUI भी करा सकते हो. You can wait also if you are not mentally ready for IVF. But IUI का success rate severe endometriosis में is comparatively lesser than the IVF. So it is one indication where we directly advise you to go for IVF cycle. Similarly, there is one more thing that is called as low AMH or egg reserve. That is not good. In those cases, a person who has already tried for a pregnancy, who has already taken multivitamins for pregnancy, even then the pregnancy is not occurring and the number of eggs and the quality of eggs is not very good, then again don't waste your precious time and directly go for an IVF cycle because in cases जिस time पे हम IVF कर सकते हैं that is the right time. Because if you will wait too long, then this is a possibility that we may not be able to do IVF cycle later on. So low AMH, even then if you have tried with medicines and injections, don't wait too long. So one is a severe endometriosis, then second is a low AMH. These are the conditions where you should not waste too much of the time in thinking or trying other medicines. Coming to the next indication for going to IVF directly is blocked tubes. If the tubes have been found to be blocked in HSG or any other test for tubal patency, then in that case you should directly go for IVF because usually blocked tubes के बाद में उन्हें open करना उतना easy नहीं होता है. If your age is younger and your egg quality is very good, then you can attempt for a laparoscopy. We do laparoscopy and we do tuboplasty in cases the blockage is very minor. Blockages there is just on the one side or there are some just adhesions are there. In that cases we open the tubes with the tuboplasty surgery. But अगर आपकी infertility बहुत long standing है, you have tried yourself for a long time and both the tubes are blocked and multiple blockages are there and hydrosalpinx are there, there is collection of fluid in the tubes, then in such cases it is again a waste of time and better to go for IVF cycle in such cases directly. Similarly, there is one more thing that is called as azoospermia in males. That means there are zero sperm count in the males. That means there are no sperms. So majority of the people can give you some medicine, they can ask you try some treatment, but if the sperms are not there, the most important thing is to check if they are getting formed inside or not. Because many a times the sperm formation is there, but they are not able to get released outside because of any blockage in the tube. So for such cases in the males, when sperms are not visible in the semen, we advise them to go for a test called FNAC, and then we plan them for TISA. TISA is a thing where we take out the sperms directly from the testis and those sperms can be used for having an embryo of your own genetic material. But many a times the patients, they waste too much of time. When they come, then data is also reduced or the quality is not that good. So there are certain indications where IVF is a very, very important and it is a very precious time where we can utilize that and we can get a positive result in IVF directly. So one was severe endometriosis, second is low AMH, third is the zero sperm count. Fourth is blocked tubes in females. So these are certain conditions where IVF is actually indicated. Now if we consider where we have to go for IVF even after doing everything else, that is PCOD. PCOS is a condition where there is a hormonal imbalance, there is some problem in the formation of egg or the release of the egg. So in such conditions, we don't directly advise them to go for IVF. We ask them to go ahead with some medicines, to go ahead with ovulation induction. Then we check how is the egg formation. Then we check how is the release of the egg. So many steps are there. And even then, if the pregnancy is not occurring with medicines, then we can give them some injections. We can do super ovulation, where we trying to make two or more number of eggs in that cycle, and we can combine it with IUI. So these procedures, they help in having a positive result in cases of PCOS. But again, if you have already tried all these things, don't waste too much of time. I would say don't wait too longer. Don't go ahead with multiple cycles of IUI again and again. If it has been done nicely, then in that case, 3 cycles of IUI are more than enough to have a positive result. And if you are not having that, better to go ahead with IVF cycle directly after that failed IUI cycles. Because in PCOS, many a times what we see, the quality of the egg is also not that good, that when it comes out, it is not able to get fertilized. Then in that scenario, everything what you did was complete waste. So always take a proper call, always do a proper judgment when to go for IVF and when not to go for IVF. Always ask for your options. There is nothing like that you have to do this or you don't have to do this. There are always some options, there are always some pros and cons of those procedures. Always ask for your options and then go ahead and decide yourself. Thank you.